Hearing is how we experience the world of sound. It's a complex process that involves our ears and our brains. Sound waves enter the ear and travel to the eardrum. The eardrum vibrates, and these vibrations travel to tiny bones in the middle ear. These bones amplify the vibrations and send them to the inner ear. The inner ear contains the cochlea, a snail-shaped organ filled with fluid and tiny hair cells. When the vibrations reach the cochlea, the fluid moves, bending the hair cells. This bending transforms the vibrations into electrical signals. These electrical signals travel along the auditory nerve to the brain. The brain interprets these signals as sound, allowing us to hear speech, music, and the sounds of our environment. Hearing loss happens when there is a problem somewhere in this pathway. It could be a blockage in the ear canal, damage to the tiny bones in the middle ear, or problems with the hair cells in the inner ear. Hearing loss can be caused by a variety of factors. Sometimes it's present at birth, known as congenital hearing loss. This can be due to genetic factors, problems during pregnancy, or illnesses the baby is exposed to in the womb. More often, hearing loss develops over time. This is called acquired hearing loss. One of the biggest culprits is exposure to loud noises. Think concerts, machinery, or even loud headphones. Over time, loud noises damage those delicate hair cells in the inner ear. Age is another factor. As we get older, those hair cells naturally deteriorate, leading to age-related hearing loss. Certain medical conditions like diabetes, heart disease, and even some infections can also increase the risk of hearing loss. Hearing loss often develops gradually, so it's important to be aware of the signs. One of the most common is difficulty understanding speech, especially in noisy environments. You might find yourself frequently asking people to repeat themselves or turning up the volume on the TV. Other signs include ringing or buzzing in the ears, also known as tinnitus, muffled sounds, and difficulty hearing high-pitched sounds like birds chirping. If you notice any of these symptoms, it's essential to see a doctor or an audiologist. The good news is that there are many ways to manage hearing loss and improve your hearing experience. The first step is getting a proper diagnosis. An audiologist will perform a hearing test to determine the type and severity of your hearing loss. Treatment depends on the cause and extent of the hearing loss. For some, hearing aids can be life-changing. These devices amplify sound and make it easier to hear. In cases of severe hearing loss, cochlear implants may be an option. These surgically implanted devices bypass damaged parts of the inner ear and directly stimulate the auditory nerve. Living with hearing loss can be challenging, but it's important to remember that you're not alone. Support groups and resources are available to help you navigate the challenges and live a full and active life. Early detection and treatment are key to minimizing the impact of hearing loss on your life.